Fibroids occur to some degree in 20 to 80% of women.
The exact cause of them is unknown, but here to talk about what may cause them and how to treat them, twin OBGYN doctors, Jay and Dr. I. Thank you both for coming in.
Thanks for having us.
We were just having a brief conversation. I would have to say I know more women who have had fibroids than I women who have not, if that makes any sense. And you were saying it's just that common.
It's that common, like you said, 20 to 80%. And for some people, it's asymptomatic, so they don't know it, and we find it incidentally. But I'm finding for more and more patients now, it's creating issues. They're having pain with their periods, pain with just general physical activity, fertility issues, bleeding issues, and it's something that we're seeing more of. And thankfully, there's more attention being paid to it, you know, and so people are now aware of it, and they're going to their doctors like, hey, is this an issue? And oftentimes we're finding it is.
So what is the cause of it, or do you even know the cause of
That's
it?
the thing. So it's what they call idiopathic. I mean, we don't really know the cause, but we know some things that can contribute. But what actually causes it, we don't know. We know exposure to hormones can, so estrogen and birth control pills. But that's an easy one. But actually, estrogen's in our foods, right? So like foods that have soy, they're estrogenic. Foods that are treated with chemicals, so non-organic foods that have estrogens in them.
A lot of meats have estrogens because they use it to kind of beef up the animals, you know?
Like the antibiotics and stuff like that?
Antibiotics and the estrogens and the testosterones, and so also just things in our homes, you know, stuff that we just take for granted. Our carpeting, you know, the nonstick cookware, plastics, things like that. They have these chemicals called EDCs, endocrine disrupting chemicals, and they disrupt your hormones. And so you get these imbalances in estrogen, and next thing you know,
But aren't there some things that we're doing as well that are causing?
Well, yeah, and so honestly, obesity is one. Obesity is one thing that people don't think about, but when you have that peripheral fat, you produce estrogen yourself. So just kind of the less healthy lifestyle that a lot of us are leading can also contribute to it. And again, diet, that's a big part of it as well. So the diet, the exercise, hormonal medications, like I said, the EDCs, things in our house, all of those are contributing.
lack of sleep.
Lack of
Sleep, yeah. Lack of sleep is a big one because, you know, when we don't rest, we tend to have the systemic inflammation. So, you know, when you're a doctor, if you can't figure out what's going on, pin it on inflammation, because 99% of things, it's inflammation.
Really?
You know?
And
so, yeah, when you have this chronic systemic inflammation, that also throws off the hormones. And again, that can lead to a whole bunch of issues, including fibroids. And so it's just our lifestyles and all of the stuff that we're doing, both knowingly and unknowingly, that's leading to this, I think.
I was shocked at how big they can get, and how people don't realize it till they're so big.
And there's no rhyme or reason. Like you have some patients where the fibroids are tiny, you know, and they have a lot of symptoms, and you have some patients where they're huge and they have no symptoms. But yeah, they can. I've had patients where literally, you know, the uterus is normally the pelvis, where the uterus is literally up here to the breastbone.
Oh my
God! But they don't have symptoms. They don't have symptoms because it grows so slowly. Yeah. So, but yeah, they can become very large.
Well, what I am happy to hear is that treatment and the removal of these have gotten so much better, because used to be when you went in for to have your fibroids removed, you were out baseline 8 weeks.
Wow.
Well, now we can do a lot of things laparoscopically. So that's the minimally invasive surgery where we make 2, 3 very small little incisions. And when you do that, you can sometimes send patients home same day. We tend not to. I like to keep people overnight, make sure they're comfortable, but you can. And people are maybe off 2 weeks, and then they're back to their normal activity.
And there's uterine artery embolization, which is a procedure where you actually go through the veins in the leg. So you have no incisions on your belly, and you actually embolize. So you block off the blood supply to the fibroid. So there are tons of things you can do now that are minimally invasive. Same thing, you go home the same day, and treat the fibroids actually, you know, quite well.
Okay, so I know that, you know, getting an annual exam is usually the best way to check these things, but when you get older, I thought you didn't have to have exams annually.
That's the thing.
That's a sticky wicket.
So that's a sticky wicket. So yeah, what they did was they basically changed the recommendations for how often you should get pap smears.
Right.
But even if you're getting pap smears every 3 years, every 5 years, you should still be getting the pelvic exam every year, where we're, you know, doing the pelvic exam, assessing the uterus, tubes, and ovaries. And a lot of women aren't doing that now because they're like, I don't need to get my pap. So they don't see us for 3, 5 years, and when they do, there's issues.
So I mean, so when you're coming in on that off year of your pap, so what is taking place? What type?
You should be getting your breast exam, getting your mammogram. If you're over 40, getting that pelvic exam, testing
So the pap smear is just when they actually do the brush on the surface.
Right.
But the pelvic exam, you still place the fingers in the pelvis to feel, and that should happen every year.
So all of that should still be happening everything but the pap smear.
I know, and they're like, does this hurt? Does it? Now, see, that's the scary thing. I never realized that your uterus was that mobile that it can end up.
Oh yeah, I mean, it can be up literally to almost the chest cavity, depending on what's going on, you know, with issues both with the uterus and tubes. And so,
And
and
ovaries.
the only way you're going to feel that is with that pelvic exam.
Now, not to scare people, because
Yeah.
I know a large part of the time they're non-cancerous, but what can happen if you ignore them?
So usually 99 times out of 100, you're right, they're non-cancerous, they can grow, but what happens is because they are hormonally dependent after menopause, they kind of tend to shrink down. But there are rare cases, we're talking like 1 in a million where they can become cancerous. That's not something to really worry about, but yeah, they usually will actually shrink after menopause. But until then, they will keep growing, so.
Okay, other than eating healthy and exercising and doing all that right, are there some other supplements that we should be taking that maybe could prevent?
Absolutely. So antioxidants, antioxidants are anti-inflammatory, so those are absolutely going to help. Sorry, go ahead.
No, I was going to say probiotics as well.
Probiotics,
Probiotics, because probiotics basically help to fight that systemic inflammation. And so, again, I think inflammation is the root of probably 99% of what we're seeing, So
Yes.
probiotics every day.
Probiotics.
Turmeric and probiotics are on my desk, and they make fun
You
of
do the
me.
turmeric, black pepper with the turmeric.
Okay.
Your body absorbs it better.
Oh, good to know.
See,
There you go.
And cinnamon.
I'll
And
send you the
cinnamon.
bill.
And cinnamon. Black pepper, cinnamon, and turmeric. Okay, what kind of slushy can I make with that? Or I make a smoothie or something?
Thank you
Doctors,
guys so
thank
much
you
for being
so
here.
much.
Follow on social media. Great follow at The Twin Doctors on Facebook and Instagram. TheTwinDoctors.com is the website. Thanks,
All right,
guys.
thank you.
So much.